Hello friends, I am Dr. Arsalan. Today we are going to discuss the topic of urethral stricture in English. If you want to watch the video in Hindi or Urdu version, then you can also find that video on our channel. For your convenience, I am going to put the link at the end of this video so you can watch it. I am making this video upon the request of international viewers so they can watch it and learn about urethral stricture. So let's talk about what is urethral stricture. The urethra is a tube that carries urine from your bladder to expel it from the body. Usually it is wide enough for urine to pass through it. When it narrows, it restricts the urinary flow and it is known as urethral stricture. Now let's discuss what are the symptoms of urethral stricture. Weak flow of urine. The patient has to strain to pass urine. The stream of the urine is spray-like in nature. Painful urination. Burning sensation in urination. Inability to urinate. The patient has a feeling as the bladder is not empty even after urination. Frequent urination is another symptom. It is because the patient is unable to empty the bladder due to urethral stricture. So these are the important symptoms which are experienced by the patient of urethral stricture. So let's talk about what are the causes of urethral stricture. It involves constriction in the urethra. It is due to the presence of scar tissue or tissue inflammation. The first main cause of urethral stricture is injury. A straddle injury is the most common type of trauma that can result in urethral stricture. It includes falling on a bicycle bar or getting hit in the area near to scrotum. Groin injury can also increase the risk of getting urethral stricture. The second most common cause of urethral stricture is urethral manipulation. Use of urethral instrument can also result in urethral stricture, such as catheterization. A history of prostate surgery can also result in urethral stricture. The last main cause of urethral stricture is STDs. It stands for sexually transmitted diseases such as gonorrhea or chlamydia. These are the sexually transmitted infection can result in urethral stricture. Now let's talk about what are the risk factors for urethral stricture. If you had a catheter recently, then you can form urethral stricture. If you had a prostate surgery or if you have an enlarged prostate, then you can also get urethral stricture. Recurrent urinary tract infection can also result in urethral stricture. So let's discuss why should we choose homeopathic mode of treatment. In allopathic mode of treatment, they dilate the stricture. It is an easy process that can be done by passing a thin rod. This is the process they do to avoid additional scarring. However, a stricture gradually narrows after each dilatation. When it fails, the doctor performs an operation which is known as urethrotomy. It is a procedure in which a thin telescope is passed through the urethra to locate the stricture. A tiny knife is then passed to cut the stricture. When it fails, the doctor advises the patient to get a urethroplasty. It is an open surgery that is performed to reconstruct the urethra. In most of the cases, it is not helpful or it can result in severe complications such as bleeding, infections, damage to penis and other organs. Therefore, homeopathic remedies are helpful in treating urethral stricture. It is because they are devoid of side effects, natural and safe. Let's see which are the best homeopathic remedies to treat urethral stricture naturally. The first main homeopathic remedy is Cantharus. It is at home in treating various urinary troubles. The main symptom to indicate this medicine is burning sensation in urination. Frequent urination is also present in this medicine. The next homeopathic medicine is Arnica. Arnica is one of the best homeopathic remedies to treat urethral stricture. Arnica is renowned for its universal curing action in injury or trauma cases. It is helpful in urethral stricture when it is followed by an injury. The next homeopathic medicine for urethral stricture is Thiocinaminum. Thiocinaminum is one of the best homeopathic treatment for urethral stricture. In addition, Thiocinaminum is renowned for its ability to dissolve scars formed anywhere in your body. It will dissolve the scar tissue in the urethra and will result in complete cure. The next homeopathic medicine is Clematis. It is very helpful medicine in the very beginning stages of urethral stricture. In addition, it is also one of the best medicines for those patients who had a history of gonorrhea. The flow of urine starts, then stops and starts again. It is another symptom to indicate this medicine. The last homeopathic medicine is Chimaphila. Chimaphila is another best cure for urethral stricture. It is ideal for those patients who have to apply a lot of strain to pass urine. In spite of all efforts, the urine is passed is very less in quantity. The main symptom to indicate this medicine is that the patient has to move his body forward to pass the urine. So that's all for this discussion on urethral stricture. I hope you liked that video, and make sure you subscribe to our channel and click the bell icon to receive the latest video notifications. Take care of yourself. I will see you in the next video.